morning, everybody. Today, as I'm filming this, it is exactly 1 month until I graduate physician assistant school. And in this video, I'm going to talk about why I chose to be a physician assistant and not a physician. But first, I have a shift. I'm going into the hospital, doing psychiatric rounds, and I'll talk to you later. Okay, I'm done in the hospital, saw all my patients, saw all the consults, and now let's kick this discussion off and talking about why I chose physician assistant over physician. And really, I think we need to start with what's the big difference between the two. So one of the big ones is the length of schooling. Physician assistant school is 2 years long. The first year is all classes. Honestly, we were in the classroom 24/7. I felt like I never left. And then the next year is all clinical rotations, usually about 10 clinical rotations throughout a year, ranging between 4 to 6 weeks in duration. So you go from surgery to emergency medicine to psychiatry like I'm in now, to family medicine, OBGYN, things like that. And medical school isn't all too different in that there are clinical rotations, set duration of time, also classes, coursework, very heavy, rigorous studies, just like PA school. The difference, of course, is that their training is spread out over 4 years, whereas ours is crammed into 2 years. And then after medical school, physicians need to go to a residency, even potentially a fellowship, which is something that physician assistants don't have to do. But with all this training, physician assistants and physicians have a lot of similarities too. We can write prescriptions, we can see our own patients, we can order diagnostic testing, we can interpret the results of diagnostic tests. We can do almost anything that you can think of medically, except for being the first person doing surgery. We can assist in surgery, but we can't be the head surgeon. And we can't really own our own practice, although that is kind of changing in certain states. And what's really key as my role as a physician assistant is that I work with a physician. I am contracted, I have agreed to work with a physician, and I'm not an independent provider in that sense. Now, it doesn't mean that the physician or the doctor is coming into the patient room with me. It doesn't mean that they are constantly over my shoulder and watching everything I'm doing. It's more so that they are there whenever I need them, whenever I need support, say for a complex case or just for another pair of eyes on something else that they may not be comfortable with. And as it ties into this length of training, it also highlights the difference between PAs and physicians, in that physicians typically are much better at handling more complex patients. People with a bunch of comorbidities, lots of issues going on, very complex cases. But one thing very similar between the two is the high demand, which is one of the things that drew me to being a PA. Demand is so high, I don't feel like I'll have an issue finding a job at any point in my career. And another similarity is just the impact that you can make on people's lives. I know it sounds cliche to say you go into medicine to help people, but truly that's part of the reason why I'm here. And one thing that ties into that extended period of training that physicians have is increased earning potential. So you're gonna earn more money, you're gonna have more opportunities for leadership and growth. But there are still plenty of opportunities for physician assistants to increase their earning potential, go into education, go into teaching, leadership within hospitals. There is a lot of opportunity for growth. I didn't really know what a physician assistant was until I was 13 years old, and that kind of changed my life. I had hurt my shoulder playing baseball, and I went to see a physician assistant. His name was Derek, and I just remember he was such a cool guy. He explained everything so well, and he seemed like a doctor. I was like, what is this? What's going on here? After talking to him, I realized what a PA was, what they do, what the training is, and from that moment, I'm 13 years old, that stuck with me to the point where here I am training. So obviously that was a huge impact for me, 13. So for anyone else out there who deals with kids, adolescents, teenagers, whatever, just know you could be making a huge impact on their life. There's really two reasons why I chose physician assistant: the lifestyle and the flexibility. Now, as it relates to lifestyle, it's going to be very different depending on what specialty of medicine you go in. Generally speaking, though, physician assistants have less duties, responsibilities than the physicians do. Physicians have call hours, they have clinic obligations, teaching obligations, administrative duties, there's just more to the job. There's more duties and more responsibilities. And while I'm not averse to responsibility or anything, it's just an extra layer to the job that I'm perfectly happy not having as a physician assistant. And I say the flexibility is really nice because PAs don't go to residency or specialize in one particular area. Because we are so broadly trained, we can work in any area of medicine that we want to. And imagine just having sriracha as your only condiment for the rest of your life. Sometimes I want some mustard, you know? Sometimes it's a mustard situation. So I'm the type of person who likes to do all sorts of different things. I get bored if I'm doing one thing for too long. So this is a beautiful career for me in that I can jump between different things. Now, who's to say I won't just love my first job and want to stick in that field the rest of my life? I don't know. And honestly, I don't think really anybody knows fully what they want to do for the rest of their lives so early on in their career. And so by having that flexibility or mobility to move between different specialties, that's very valuable for me. And so I feel like I made the right decision. All that being said, I love my physicians. Of course, I love physician assistants. This is the career that I'm really excited to practice the rest of my life. It's a commitment and it's a long journey in medicine. No matter what you're studying in medicine, I love you. We all know how hard it can be and how long those study sessions can be. But your patients thank you. The whole care team thanks you. It's gonna be a journey. Follow along for the ride. Please like, please comment, please subscribe, do all that jazz. And don't forget to live your life out loud.